All right, so lupus and gout, rheumatoid arthritis and lupus are both autoimmune diseases. So this is autoimmune and these are autoimmune, like I said here. All right, gout is not autoimmune. So lupus, autoimmune, and it affects the entire body. So you can have, it's basically a multi-system inflammation issue. So you can have different organs affected, joints, organs, skin. These people can have anywhere from mild lupus. There's something called a skin lupus. If you want to like Google that and look that up, it's just called skin lupus. All the way to systemic inflammatory lupus, where you have kidney failure, heart failure, etc. So it just varies. Some people can live a normal lifestyle and some people are real debilitated with it and end up on dialysis. So one of the key hallmark signs is red cheeks, which I don't know are my pink one. Very pink cheeks. Very pink cheeks. But what it is, it's like a butterfly rash over the nose. Those look like earmuffs. Oh my God. Okay, just know that this is called a butterfly rash. And we can't get it mixed up with rosacea, because rosacea commonly, like I have rosacea, so you can probably see red. I don't have lupus, but it's because I have broken capillaries. That's different with the butterfly rash for lupus. It's usually pretty profound. And diagnosis for lupus is not easy. I mean, you have to have the $1 million workup and have all these interleukins and complements, and there's like this Smith protein, and that's beyond your rheumatoid factor, your ANA, your and all these other labs that you have to get for that. So, so just remember that with these people, it's all over. So you still have stiffness, you still have pain, but you also have internal issues, and then you have GI issues, which is common for that too. All right, now we're going on to gout. Gout is so painful, it's not even funny. Anybody that has gout would tell you that it's the worst pain that they ever felt, unless they've had a kidney stone. But gout, this is actually a leg and this is a knee, okay? But let's go to the toe first. The most common spot here is the great toe. This joint here becomes swollen instantly because gout is uric acid crystals that can build up into the joint, and that's so painful. If you look under a microscope and see uric acid crystals, they're like pointy. So can you imagine having a whole bunch of those in an area it's not supposed to be? So it accumulates in the joint. Most commonly the great toe. And it can also affect large joints, which is I have an ankle here, and this is supposed to be a knee, although it doesn't look like a knee, but that's a knee. So you can have, and it probably does get swollen like that, but it gets super red, hot, swollen, comes on instantly, and you need medication to bring it down right away. So this is where colchicine comes in. You can also give prednisone, you can also give naproxen, high dose ibuprofen, which would be about 800 milligrams. But colchicine is been around for so many years now. It used to be given every hour until you have diarrhea, and then realized that why would we want people to take so much they have diarrhea? So now there's a Colchris that's out where you can take like once or it's like twice a day or something to help get that uric acid down. That's what it does. It helps decrease the uric acid, get rid of those crystals because they deposit there. No one wants you to touch any of this. If you have that, you don't want a sheet on you. You want to make sure that the sheet's over the bed, like the back of the bed, instead of resting on the foot or the leg. That's how common it is. So these people need like a diet that is low in uric acid. So look up that diet. I know organ meats is part of that, but I like no beer and things like that. So we see a lot of people with gout, men more common than women, and people that are overweight tend to have more of an issue, that are obese, etc. There is preventative medications out there. Allopurinol is one of them. It's the most common one. This can affect your kidneys, so you want to monitor the kidneys when they're on allopurinol. But I think the most important takeaway with gout is that it's super painful. It comes on suddenly. It will decrease pretty quickly, which is a good thing because they'll get relief of pain. But they need to be on the colchicine or prednisone or a high-dose NSAID. Indomethacin has always been the drug of choice. Indocin is an NSAID. It's always worked really well for gout, but it can wreak havoc on your GI system. So some people take it and do fine. It's only short term to get this inflammation reduced. If someone has one bout of gout, I usually don't put them on allopurinol, but if somebody, I'm talking about in the foot, if they have a recurrence in the great toe, then I'll think about putting them on a preventative, but not the first time. But if someone has a large joint involvement, because that can just destroy the joint, they're going on a preventative on the first time, because it's the last thing we want is destruction of a large joint. That would be very debilitating. They're on colchicine. You monitor their uric acid levels. It should be less than 4. There's different varying ranges though, so you don't have to memorize ranges, anything. I'm giving you this information for learning's sake. And then you add the allopurinol once the uric acid's better and they're feeling better for prevention. All right, and that's it.